I'm Shirley Bergin. I'm a partner and COO, CMO at TEDMED.
James Cheung, Global Creative Director at TBWA WorldHealth.
I think you become a creative disruptor by breaking down silos. I think you become a creative disruptor by walking away from best practices, reframing and reshaping mental models, thinking about things in new and fresh ways. And I think you're addressing big, meaty problems, big, complex problems in creative ways.
I think the dreamers, as I call them, they're not waiting for someone to solve a problem for them. They're not doing that. They're taking it, in their own hands, and they're trying to do what they need to do before somebody else tells them. So it's not prescriptive, it's actually very disruptive.
The way that I think I look at it, and I know TEDMED does as a whole, is today we're seeing more innovation and more disruption in health than ever before. And I think it's only going to increase. As the human steps up to the table and is actually involved in health for the first time, really takes an active role, health becomes much more accessible, approachable, engaging. I think that innovation, the sky's the limit. We're seeing all kinds of amazing entrepreneurs coming from outside of healthcare into health to completely disrupt the landscape. And I don't look at or don't think we think about being handcuffed in any way. I think that regulation is there for a reason, and I think there's an opportunity for us to work together to come up with creative solutions that ultimately provide the answers to the problems we're looking at.
Yeah, I think I like the way Shirley talks about we need more humans to come into this category. So it's not just about healthcare professionals solving problems, and so the restraints are always going to be there, but the way to disrupt it is sort of to ask for forgiveness rather than permission. I think the clients with the entrepreneurial spirit are willing to take that risk, and I think it's just as important to find those partners so that you can do these great things together. People have to have the same visions.
Mm-hmm. Like-minded partners for sure, and those that are eager and willing to step outside of the status quo and be those change agents who stand up first to say, we're going to think about this problem different. Events like this are huge. In fact, we were talking about this backstage with a couple of the entrepreneurs. So many of these entrepreneurs are used to going to events that are very, very silo-driven. It's your healthcare conference around health policy. It's your healthcare conference around oncology or cardiology. Very siloed, very specific to a discipline. And when you engage people around the creative spirit of what goes into thinking about these challenges we face in health and medicine from a completely new lens, you open up the door for the world to embrace health. You make it not necessary to have a PhD or an MD background in order to be involved in health. You open the door for everybody from all backgrounds to contribute, and we think that's where real change is going to happen.
It's taking people out of their comfort zone. I mean, we had two speakers today, two innovators, who one is a design engineer and the other was a serial entrepreneur. So it's not the typical category that you'd expect people to come into, and people are solving these problems and actually saving the world from a different point of view.